Good afternoon. Today we'll be going over Allen's test. The objectives of this video are to go over the test description, the purpose of the test, what a positive test is, definition of statistics. We'll go over what the research shows, and we'll do a little practice and demonstration to get some tactile understanding. The test procedures. The patient isn't sitting. The therapist will palpate and apply pressure to the radial and the ulnar arteries using 3-finger grip on each artery. The patient's going to then make a tight fist, open and close the hand 10 times, and you want to end with the hand open. It's okay if the hand does appear white. That is very normal since we are blocking off the blood pressure to the hand. The therapist will then release the pressure from one artery, allowing the blood to flow back in. The purpose of this test is to assess the arterial blood flow to the hand. When we apply the pressure to the hand, the blood is of course limited to the hand, affecting the blood flow. So this again assesses both radial and ulnar arteries. The Allen test is commonly used after operations to determine whether or not the hand has normal blood supply still or if something went wrong during surgery. A positive test is when it takes longer than 5 seconds for the blood to return. And it's important to check both arteries. So you can release the ulnar artery first or the radial first, doesn't really matter. But then you should check the other one as well to make sure that artery is not occluded. Statistics, the diagnostic accuracy of the test was 79.6. The sensitivity, which is the test's ability to correctly detect patients with obstructed blood flow, was 75.8%. The specificity, which is the test's ability to correctly detect the patients without the condition, was 81.7%. Both pretty average numbers, not great, not awful. When do you want to use Allen's test? It's used to determine whether the patency of the radial or ulnar artery is normal. So if you have a patient with cool, clammy hands and you want to determine whether or not it's another condition, you could just do this test quickly just to see how the blood's flowing through their hands. And then, as I mentioned earlier, it's performed after surgeries to make sure the blood flow is fine. It can also be performed prior to radial cannulation, since those patients can be at risk for thrombosis. So it can just be a test to make sure that they're not at a greater risk. Here's an article that I went over. It goes over the reliability of Allen's test in selection of patients for radial artery harvest by Jarvis M.A., Jarvis C.L., Jones, and Spite. It's from the Annual Thoracic Surgery. They had 93 hands in 47 patients. I'm not sure what happened to that last hand there. The mean age was 63.6 years. The receiver operating characteristic analysis found that a conventional cutoff of 5 seconds, which is what we're using, diagnostic accuracy was the maximal 79.6% with this test. The sensitivity was 75.8 and the specificity was 81.7. So the results from the article, they determined that at no point does Allen's test perform satisfactorily as a discriminatory test. It should be, you can do it as, again, kind of general guideline just to get a pulse on things to see how everything's going. But it should be backed up with more definitive things such as a Doppler ultrasound. And in 3% of hospitalized patients and with an inadequate collateral blood supply was diagnosed by the Allen's test. So it's not a huge diagnostic tool for us. It should really just be done as a very quick check, and then we should get more means with better results. Here are the multiple choice questions. I won't read them off. Here are my references and the video. For this test, the patient will be seated. We will first palpate the radial and ulnar arteries. We'll have a 3-finger grip on both sides. Make sure you feel the pulse on both arteries. Have the patient open and close the hand 10 times. The hand should be going white. I'm going to release pressure on the radial artery. Normal response is for blood flow to return to the hand within 5 seconds. Positive test would be if the blood flow does not return to the hand. Make sure you repeat it on the ulnar side as well. Alright, and grab a partner and let's practice. Thank you for watching.